Each of our intramuscular kits come with 3 doses.
As the executive director of the Steve Rumler Hope Network,
I am very surrounded by people who have been affected by this crisis.
Alicia House is carrying on the legacy of Rumler, a Minnesota native who died of an overdose in 2011.
Keeping those families in mind and those lost loved ones is really key to continuing to push the work.
That work has grown even more urgent since COVID.
Some are arguing we are absolutely in a fourth wave of this crisis. There was unfortunately just a lot of people who were maybe looking for recovery or early on in their recovery that had lost community.
Since 2018, overdose deaths have more than doubled in Minnesota. After reaching a peak of 1,356 deaths in 2021, preliminary data in 2022 shows a slight drop to 1,343. Although that could change when data is finalized.
It's almost like we're hitting a little bit of a plateau.
At the same time, emergency room visits related to opioids have also soared in Minnesota, topping 4,000 each of the past 3 years.
Which tells me that there are a lot of potential fatalities that fortunately aren't being added to that overall overdose death count.
Part of that has to do with the expanded access to life-saving naloxone, sometimes known by brand name Narcan.
The medication inside Narcan that reverses the overdose is naloxone.
This year, the state legislature passed a new law mandating that all police officers carry naloxone and that all schools have the medication available. Even before the mandate, Minneapolis police moved in 2018 to equip all officers with the medication.
We can save lives. We can save lives, and if we can save just one, this pilot at the end of the day will be worth it.
And schools like Bloomington have had naloxone or Narcan for years.
It was kind of a no-brainer because there was no harm by stocking it.
At the Steve Rumler Hope Network,
access was already there, but now just more access.
Alicia House says the new law is a small step towards solving the opioid epidemic.
We're doing it in hopes that another family doesn't have to suffer the same loss that they did.
Also this year, Governor Walz signed a bill putting $300 million into a state opioid response fund. That money came from the state's share of a settlement in a lawsuit against opioid manufacturers.